The urology group is a practice of 10 urologists and 5 advanced practice providers providing comprehensive urologic care in Northern Virginia and the greater Washington area. Our practice was founded in 1924. We're excited to be coming up on our 100-year anniversary. We suspect we're one of the oldest private practices in the country. What sets us apart is that we offer full academic acumen of procedures and urologic care with the compassion of a community hospital touch.
In the past, urologists were mostly involved with the initial diagnosis and surgical treatment of various urologic cancers, and managing progressive disease would then be transitioned to another specialty. However, these days, we've realized that these patients best benefit from continuing their care with their own urologist, who has both the depth and the breadth of expertise to manage their more advanced condition. That realization has pushed us to grow our practice in many exciting directions.
We started a multidisciplinary cancer clinic in an effort to replicate what you see at an academic institution. So we have a urologic oncologist, a radiation oncologist, and a medical oncologist that meet to review the cases and present a united front to the patient, and also allow them to explore all of the various treatment options that are available depending upon the stage of cancer that they have, whether they're initially diagnosed or whether they have metastatic disease, and whether they're transitioning from one stage of disease to a recurrence, etc. They get all of these opinions, and hopefully we are providing comprehensive care locally for them.
In keeping with this model of comprehensive longitudinal oncologic care, this past year I focused on bringing all of our advanced oncology services in-house. From the inception of our in-office dispensary that provides cancer patients with the latest advanced therapeutics, to initiating genetic testing, to starting a patient navigation program to ensure adherence to clinical pathways and best practices, to incorporating population health and data analytics software to use the latest that technology has to offer us to augment the human side of patient care.
We thought it was important to create a female urology service line in order to help women feel comfortable coming to the urologist. So many of my patients delayed presenting to care due to embarrassment or concern that some of their issues would be dismissed as part of normal aging. We try to stress that treatment and management of incontinence and prolapse is important to help keep women active and thriving. I think that the new surgeries and medications that we have in this space are really exciting, and they're helping women get results faster and with less side effects. We use minimally invasive robotic surgery to correct pelvic organ prolapse. This allows for a strong and lasting repair with a relatively rapid recovery time and often a same-day discharge.
Well, describing the role of robotics in reconstructive surgery, the first thing that comes to mind is that reconstructive urologists can overcome obstacles. Most of those are due to poor visibility during surgery. But the principles are similar to open surgery. The idea is to restore normal function by repairing, rerouting, or recreating areas of the upper tract and lower urinary tract. And we also include the genitourinary system, which includes the reproductive systems. Our office offers many reconstructive procedures, but what sets us apart is that we offer a comprehensive approach. Not all urologic reconstruction procedures involve just the GU tract. We cross into multiple specialties which require urologic reconstruction in combination with gynecologists, urogynecologists, colorectal surgeons, general surgeons, and our new partners, neurosurgeons and orthopedic surgeons that do an anterior approach to spine surgery.
So with the advent of COVID, our practice started meeting more frequently in an online format. We currently meet about every 6 weeks, and each of us share different projects that we're working on. We include our administrators and advanced practice providers because they're an important part of our team. This benefits patients because we're constantly instituting new programs and practices to adhere to new guidelines and practice evidence-based medicine that's put out by the American Urologic Association.
The urology group is trying to make sure that we are doing things on par with what we would consider to be an excellent academic center. We have people that are fellowship trained, we have people that are specializing in certain areas of urology, and these are all things that we've learned throughout our training and do provide better outcomes for our patients.
I think what's unique about our group is the collaborative nature of our surgeons. We all work together. It's not uncommon for us to discuss complex cases, to share experiences, or even operate together. It creates a great work environment for us, but it provides the patients the benefit of multiple perspectives approaching their issues.
I think this is a really exciting time to be practicing urology, and at the Urology group, our focus on innovation, leadership, and clinical and surgical excellence helps us deliver the best possible care to our oncology patients.
We've been able to maintain the trust of the community for almost a century by providing the latest technological advances and being at the forefront of urologic care. Our mission is urologic care of a full academic department with the compassionate care of a community practice.